let us know who's joining us for today's conversation. Please do also use the chat box to enter any questions that you might have. We also have the formal kind of Q&A contribution box, but all of our panelists and speakers today will be able to interact with you in the chat box throughout the session. And similarly, for our friends joining us on YouTube, please do add your comments there, and they will all be fed back to our panelists, and we'll be introducing those and bringing those up during the Q&A portion of today's webinar. But really what we want you to do is to participate and enjoy. Know that if you want to tweet and share, you can follow today's hosts, UNU IIGH, as well as the Third World Network on Twitter. And if you're already here, that means you found us. But afterwards, the live stream of today's event will be kept for posterity on the IIGH YouTube channel. Just to give you a sense of where we'll be going today, I'm going to give you a little bit more of an introduction before I pass over to Ben Wood, who's joining us today to present the research findings from the report, which will then be followed by a keynote presentation from Richard Kozel-Wright. We will then have three panelists joining us, Chi-Yok Ling, Henrik Baal, and Anshu Banerjee, who will be giving their perspectives on the information that's shared today before we move into a discussion and a Q&A. Now, before we get there, a bit of backstory. In February of this year, my husband and I were extremely excited to welcome the arrival of our second daughter, Violet. Despite the fact that we already had one, I still had many concerns about successfully feeding my daughter whilst juggling another child, work, and the realities of daily life. Parents are constantly bombarded with messages on all fronts, from well-meaning friends and family, healthcare practitioners, online influencers, and commercial actors. And it's undeniable that the discussions around breastfeeding, commercial milk, how to feed your child, and basically everything parenting can become extremely polarized. There are many factors that influence both desired and actual approaches to newborn and infant feeding, as well as the all-important personal preference and what works best for a given family. It's important to acknowledge the many external factors that influence the decisions made, from provision or lack of lactation support to a lack of enabling national policies, for instance, in relation to maternity leave. These and other factors will be discussed in a forthcoming Lancet series on breastfeeding, due to be published early next year. Today's discussion, however, will focus on the outside influence of the commercial milk formula industry, its aggressive marketing of breast milk substitutes, and its systematic undermining of breastfeeding. The research being presented at this webinar was initiated by my IIGH colleague, David McCoy, who unfortunately is unable to join us today. He started this work whilst at Queen Mary's University, London, and working closely with the World Health Organization on the aforementioned series of Lancet papers about infant and young child feeding and the commercial drivers that undermine breastfeeding. That work was funded by WHO and has made both this report and the series possible. And so we are delighted to have Anshu Banerjee representing WHO at this webinar today. David is now based at UNU IIGH, which partly explains why we are co-hosting this webinar. But perhaps more importantly, this webinar fits within a new programme of work that we've launched on decolonising global health. A full description of that programme can be found on our website, but one of the important foci is how the global health system interfaces with contemporary corporate and financial neocolonialism. If neocolonialism is defined as the extraction of wealth and profit in ways that are harmful and exploitative, then the manner in which transnational corporations and private financial actors extract profits, undermine democracy, and hinder sustainable development can and should be described as colonial in nature. While it's important to promote more equitable, respectful, and non-exploitative relationships between all health actors from the global north and from the global south across the global health landscape, as a community, we must also challenge the neocolonialism of transnational corporate and financial actors if we truly want to decolonize global health. We are therefore excited to be co-hosting this webinar with the Third World Network, a civil society organisation that has long been at the forefront of political economy research and advocacy. We're delighted that Chi-Yok Ling, the director of Third World Network, will be speaking later today as a panelist. Anshu and Yok Ling will be joined by Henrik Wall from Save the Children as our third panelist. Apart from Save the Children's long-standing commitment to all matters child health, they've also recently been working on the potential role of investors and shareholders in protecting infants and mothers from the harmful marketing practices of the commercial milk formula industry. But before we get to our panelists, we will hear from Ben Wood, who will present the research in the report. Together with Dermot O'Sullivan, Ben was two of the primary authors of the report being presented, and he is currently a medical doctor and an academic based at Deakin University. After Ben, we'll hear from Richard Kozel-Wright from UNCTAD as our second main speaker. Richard is the director of UNCTAD's Globalization and Development Strategies Division and is a leading expert on the working of today's globalized and financialized economy. We are honoured to have him here. We are honoured to have all of our panelists and speakers here with us today, but we're particularly delighted to have established this new relationship with UNCTAD, an important organisation that represents the needs and interests of the Global South within the UN system, just as UNU IIGH strives to do. So with that, that's enough from me. Ben, I'm going to stop sharing my slides and pass over to you. I hope you enjoy where we're going.
Fantastic. Thanks very much, Emma. Is that okay? As my slides have come up? Perfect. So huge thanks to those at the Third World Network and the International Institute for Global Health for their support with organising the publication of this report and this webinar. And good morning, good afternoon, and good evening to everyone. And thanks for joining us today. I feel very lucky to be able to talk a bit about our report, Who Benefits from Undermining Breastfeeding. First, I would like to acknowledge my co-authors listed here on the slide. So I'm just going to move, there we go, as well as those who kindly offered to review drafts of the report at various stages. Excuse me. I'd also like to disclose as well that this study is part of a wider program of research that has been funded by the World Health Organization through a grant provided by the Bill and Melinda Gates Foundation. The research was conducted entirely independently by the listed authors, who are solely responsible for the study and the contents of this report. Okay. I also feel that it is important to point out right from the start that this report is not a critique of parents, nor the decisions that we make as parents. Instead, this report is really a critique of the powerful corporations and investors that lie behind the products, behind the brands, behind the pervasive marketing and their aggressive pursuit of profits and shareholder returns. My presentation today is organized as follows. So first I'll provide some background. Then I'll talk about the aims of the report and the methods and data sources used. Then I'll go over some of the key findings and discussion points before outlining some government policy recommendations. And finally, I'll outline some of the key limitations as well of the study. It is well recognized that the global commercial milk formula industry has a major influence on health and health equity around the world. So in 2016, the Lancet series on breastfeeding noted that around 823,000 child deaths and 20,000 maternal breast cancer deaths would be prevented in each year in low and middle income countries if breastfeeding rates reached near universal levels. It is well known, though, that one of the largest barriers to increasing breastfeeding rates in many contexts is the commercial milk formula industry, especially its aggressive and pervasive marketing of infant formula, which really serves to displace breastfeeding. International efforts to eliminate the harmful marketing of breast milk substitutes, especially milk formula, are long-standing. So notably in 1981, the International Code of Marketing for Breast Milk Substitutes was adopted by the World Health Assembly. But more than 4 decades later, there is extensive evidence to show that company violations of the code continue to be systematic and widespread. Moreover, only a small proportion of countries have implemented most or all of the provisions of the code into law, with an important reason for this being the milk formula industry's undermining of the adoption, implementation, and enforcement of code-aligned national laws and regulations. And so alarmingly, and really in spite of the code and related public health efforts, the global commercial milk formula market has grown rapidly in recent decades, especially in highly populated low and middle income countries in the Asian Pacific region. Such rapid growth is in part a reflection of the power of the industry's most dominant corporations. So we know that large milk formula corporations are able to spend billions and billions of dollars on marketing, and often quite sophisticated marketing techniques, to influence choice, to drive consumption, and to normalize formula feeding across diverse country contexts, which is made possible because of their ability to also influence policy, regulatory, and knowledge environments. One of the key narratives that the milk formula industry often uses to argue against government regulation involves emphasizing the industry's importance to development and prosperity for national economies, such as by highlighting employment numbers and the investments the industry has made or is planning to make. The story then typically follows that regulation would likely lead to adverse economic consequences for the national economy in question. These claims, though, that underpin this narrative have rarely been subjected to critical analysis, which leads me to the aim of this report, this study, which was to critically explore these claims by specifically examining some of the ways in which the industry generates and distributes its wealth and income. So for this study, we used multiple methods and data sources to explore 4 key dimensions of corporate wealth and income distribution. So first, we analyzed the size and concentration of national milk formula markets around the world. Then we explored the profitability of milk formula by analyzing the company documents of the 4 global market leaders as of 2020. So these were Nestle, Danone, Abbott, and Reckitt. And because Reckitt acquired Mead Johnson in 2017, we looked at either or both Reckitt and Mead Johnson in analyses. Third, we explored taxation by calculating effective tax rates since 1990, as well as by analyzing the company documents of the 4 global market leaders. And finally, we analyzed the industry's distribution of wealth and income amongst market stakeholders, including by examining total shareholder returns in the form of dividends and share buybacks. So moving on now to some of the key findings and related discussion points. So firstly, we found that the global commercial milk formula market really consists of a patchwork of mostly highly and very highly concentrated markets, many of which are dominated by just 1 or 2 of the dominant transnational milk formula corporations. And so this is really characteristic of an oligopoly. And essentially what this means is that the large and increasing revenues generated from milk formula sales around the world are concentrating around a limited number of firms. The rapid growth and extensive concentration of milk formula markets has really important economic and political implications for public health. So to start with, high market concentration likely confers dominant milk formula corporations with structural and relational power over workers, over suppliers, over retailers, and over parents, which then allows these corporations to drive down business costs and to aggressively market really cheap to produce products with high profit margins. And this is a point we'll return to shortly. High market concentration also serves as an important source of the extensive political influence of large milk formula corporations. So just as one example, large corporations in highly concentrated markets are generally better able to coordinate efforts to undermine industry-wide regulations, which with respect to the milk formula industry is something that has been shown and is well discussed in the public health literature. We found that Nestle, Danone, Mead Johnson, and Abbott have published enough data to suggest that milk formula is highly profitable and that it accounts for a significant share of their global profits. And so Mead Johnson's data are particularly insightful because the company explicitly reported data on its milk-based powder products. So between 2011 and 2017, Mead Johnson reported profit margins on milk formula between 21 and 23%, which is much higher than most consumer goods. And as milk formula is relatively cheap to produce and is mostly a standard product, high profit margins are in part a reflection of the extractive nature of milk formula corporations. And so this value extraction, so referring basically to the appropriation of wealth rather than the creation of wealth, likely includes, for instance, the extraction of value from families and households, so which represents money that really can no longer be spent on purchasing essential household items and services. So in Changing Market Foundation's Milking It report, it was noted that in China, it can cost up to 40% of the average monthly salary to feed a baby using premium milk formula products, or else around 15% of the average monthly salary using cheaper milk formula products. The extractive nature of the industry also encompasses its externalization of a considerable amount of health and environmental costs, including those that relate to increased mortality and morbidity for children and mothers, healthcare and economic costs borne by governments, the environmental harms associated with milk formula production and packaging waste, and intergenerational costs associated with the above. Low taxation is another important extractive pathway used by many transnational corporations, whereby value is essentially extracted at the expense of public revenues of those where more tax would otherwise be paid. So two key points I think that can be taken from this figure is that from 1990 until the mid-2010s, there was an overall trend downwards in the effective tax rate of the industry as a whole. Second, and importantly, the effective tax rates of Nestle, Abbott, and Mead Johnson in particular were well below the rest of the industry in the 1990s and early 2000s. A closer look at Mead Johnson demonstrates some of the ways in which the use of tax havens can reduce a transnational corporation's global effective tax rate. So after documenting that it had secured tax rulings in the Netherlands and Singapore, so both of which are tax havens, Mead Johnson reported large amounts of profits in both countries, even though both have relatively small domestic markets for milk formula. And so this strongly suggests that the profit was being shifted to these countries from other countries with higher tax rates. Now, this effect appears to have been quite large, with Mead Johnson reporting in 2016 that unspecified tax rulings and agreements were reducing its global effective tax rate by a staggering 13%. And so while the milk formula industry has sought to lower its tax obligations, it has concurrently been increasing the transfer of its wealth and income to its shareholders in absolute terms, as well as relative to capital expenditure and total revenue. So in this study, we drew from work recognizing that capital expenditure, more so than employment numbers, is a useful proxy for the long-term interests of workers by gauging the relative commitment of firms to advance productivity, innovation, and job creation through long-term investment. Broadly speaking, these trends suggest that the industry appears to be prioritizing the interests of shareholders above the interests of other stakeholders in a manner highly consistent with the maximizing shareholder value ideology. And so where are these shareholder returns flowing? Well, we estimated that the overwhelming majority of traded shares in the milk formula industry is held by investors based in high-income countries. Like most of the global corporate economy, an increasing proportion of shares in the milk formula industry is held by very large institutional investors. Now, these investors are not the ultimate owners of the assets they manage, but it is important to note that the assets under their management, including those in pension funds, tend to be disproportionately owned by the wealthiest in mostly high-income countries. So what do these data and these findings indicate? Well, contrary to industry claims about its role in creating economic value and contributing to sustainable development, the ways in which the milk formula industry generates and distributes wealth and income are likely contributing to widening economic inequalities. Thus, it can be understood that the milk formula industry negatively impacts on health, not just by driving ill health and health inequalities, especially by undermining breastfeeding, but also by driving and reinforcing economic inequalities that really do act as important social and structural determinants of ill health and health inequity. And so with this in mind, we urge governments to treat the claims often made by the milk formula industry framed around economic value with strong skepticism. Several government interventions with the potential to reduce the health and social burdens created and perpetuated by the milk formula industry are well documented in the literature, including those related to the complete adoption, implementation, and enforcement of the code, the universal protection and promotion of parental rights, and the widespread support and promotion of breastfeeding. On this slide, I'd like to outline some examples of complementary interventions that could protect and promote public health really by dispersing and redistributing the concentrations of wealth and power held by dominant milk formula corporations and their investors. The first example is antitrust law, which is one of the most powerful tools that governments have at their disposal to disperse excessive corporate power through regulating market and economic structures, as well as abuses of market and economic power. Importantly, I think a strong case could be made that high market concentration and excessive market power can lead to an increase in consumption in certain markets, such as by facilitating enormous marketing expenditure, as well as the capacity to undermine consumption reduction related public policy. And I think it's also worth noting that in a number of jurisdictions, public interest considerations, such as those related to the economic development and prosperity of disadvantaged population groups, are integrated into antitrust regulation. Progressive tax policy has a potentially important role to play in addressing some of the adverse impacts of the industry, including by removing the tax advantages available to the largest corporations, as well as by raising more of the public finance necessary for the provision of essential goods and services. Relatedly, stricter corporate disclosure laws are clearly needed to ensure greater corporate accountability and transparency with respect to flows of profits and taxes. So a pertinent proposal in this regard is mandatory public country-by-country reporting, which would require transnational corporations to annually disclose their turnover, profits, tax payments, and other key financial data for each jurisdiction where they operate. And as a final example, corporate law has a potentially important role to play as well, such as by mandating corporate decision makers to fully consider the interests and thus the rights of all stakeholders. And so in doing so, this could provide a robust legal framework to help counter the very powerful normative framework related to maximizing shareholder value. And so for my final slide, I just want to briefly outline some of the limitations of the study. So first, I think it's important to note that analyses of and discussions related to the distribution of corporate income, including taxation, by the global milk formula industry are not only specific to income generated from milk formula sales, but to income from all sources. Second, effective tax rate is a relatively crude measure that is subject to many variables, including some out of the control of the corporations in question. And third, we do not include indicators such as employment figures, wage dispersion, and working conditions in our analysis, mainly due to limited data, and also because of the scope of the study. In this respect, though, future research could include in-country studies to examine context-specific health and equity impacts of the milk formula industry's generation and distribution of wealth and income. So on that note, thank you very much for your attention, and I look forward to discussion and question and answers.
Thank you very much, Ben, for walking us through the main findings of the report. I'd now like to quickly pass over Richard for him to talk us through his perspective. Thank you, Richard.
Thank you, Emma. Thanks to TWN for the invitation. Have to say, when I received it, I felt I was probably a little bit outside my comfort zone on this topic. Not having dealt with child rearing for a long time, I have to say. But I think the work we've been doing in many respects complements what Ben has said about the specific dynamics of the baby formula industry. I came across the issue, as perhaps many people did, with the crisis in the United States about the shortages that were reported earlier this year, which was somehow often associated with the kind of breakdown of supply chains and the problems coming out of COVID. But when people began to look at it, and at least the things I read, clearly there were some underlying factors there that pointed to more or deeper problems with the structure of the industry. Four companies control something like 90% of the US baby formula market. Markups were particularly high, and Ben gave some figures for the average. I think those are similar figures for the United States. You had this government support scheme, the Women, Infant, Children's Program, which was a major buyer of baby formula in the US, but was also a form of corporate welfare with little oversight in it. And of course, you had the lobbying that was associated with those two features, a lobbying that was exposed when the US delegation opposed the WHO resolution on breastfeeding, I think, under the Trump administration. And of course, you had the inequality factor because clearly poorer and minority households who tend to use baby formula more extensively were hit by the shortage and also by the rising prices that have taken place also in those markets over the last year. And I guess in a microcosm, in that sense, the industry reflects a wider changes in the global economic landscape over the last 40 years, and particularly, I think, since the global financial crisis, when people have become more apparent of some of these underlying tendencies which we associate with a hyper-globalized world. Reforms were promised and not really delivered. And those underlying tendencies, I think, which go beyond any individual sector, are of course the problems around inequality, which is a complicated issue. Of course, we, in the work that we've done, have tended to focus on the distribution between wages and profits, or wages, profits, and rents, in understanding the inequality dynamics under a hyperglobalized world. And the trends are very ubiquitous. Wages, the share of wages in income have been declining everywhere. The share of profits in income have been rising everywhere, and that's true of both developed and developing countries. There are interesting cases that buck the trend, but it's a remarkably ubiquitous trend that underpins many of the other dynamics around growing inequality that I think we're all familiar with. There's a second, I think, and we would say related trend in this hyperglobalized world, and a surprising one that doesn't get enough attention, which is that despite this is clearly a world that has been rigged in favor of corporations, investment rates across the world have in fact been declining, and the use of profits to reinvest in productive capital has been on a significantly declining trend. There's a remarkable figure by research from Bill Lazonick that for the S&P 500 corporations for, I think, the period in the first 15 years of this century, which found that for every $10 of profits, 9 of those $10 was used either for increasing dividend payments, Ben talked about that, and also for buying back shares, which left a very small amount of remaining profits to be used for research and development or or investment in expanding capital stock or skills or whatever. So that investment gap is a second big trend that we've identified in this hyperglobalized world. There's a third trend, again a familiar one, around growing senses of insecurity, both in the workplace, obviously, where informality has become not just a feature of southern labor markets, but also of advanced economy labor markets. But there's insecurity also linked to the general degradation of public services under the forces of deregulation and austerity, and the general decline in tax rates of high-income individuals and corporations that have put stresses on governments to provide those services. And the last of the big kind of trends, I think, that speaks to a lot of what's been said already, is the growing levels of indebtedness that you see, not only for households, but also for firms and for governments. So this trend in which people are being forced to borrow to maintain a certain standard of living, in which governments are forced to borrow to deliver on their public responsibilities, again a ubiquitous feature across both developed and developing countries. So I think those trends of inequality, investment shortfall, insecurity, and indebtedness have become systemic features of this hyperglobalized world. The explanation, I mean, there are a set of reasons why that's happened. There's clearly been an ideological shift behind that. I mean, the rise of neoliberalism, or whatever one wants to, however one wants to describe that ideological shift, not often kind of rather crudely described as a shift from state to market as the overriding mechanism to deliver economic outcomes. So that's a bit misleading. It's not that neoliberalism never preached the demise of the state. It just preached that the state had to be contained in certain areas, particularly those areas where profit making was possible. And I think that a important feature of the neoliberal discourse is that profitability rules as the overarching narrative for determining whether something was good or bad. So that focus on profitability, and with it a kind of focus on individuality and entrepreneurship, better describe the kind of ideological shift than is often attributed to a state versus market type of dichotomy. But in many respects, I'm not sure that the rise of neoliberalism, it was never an independent kind of factor, and I'm not sure it's the most important. We've, in our work, tried to emphasize two other dominant features that I think speak to what Ben presented in his slides. Of course, the first is the kind of financial. It's not just the rise of the financial sector, but it's the financialization of economic activity, in which everything becomes essentially an asset class whose risk return profile can be instrumentalized through various financial techniques, and in which rather than making stuff being the dominant feature of the economy, rent-seeking behavior has become the kind of key profit-making strategy, particularly for larger corporations. This tends to have produced a very kind of short-termist view of economic activity, very speculative often in the way in which it understands the use of its own resources, avoiding lock-in to longer-term commitments, and a highly footloose type of capital that goes along with those kinds of values has certainly been a feature of this hyperglobalized world. So that financialization story, for which there's an extensive literature, is certainly a very prominent feature of today's global economy. And alongside that, and I think this bit, and often neglected in that story, is a more general shift in the power of corporations or corporate control that has become increasingly apparent over the course of the last 2 or 3 decades, and that so in that sense, corporations have become themselves financialized, in which the control of assets has become a critical feature of their profit-making activity, largely through dominating particular market sectors, often with a fairly predatory type of strategy accompanying that. And we've tried to measure that for the global. I mean, I think that's very much the story that Ben tells in the case of baby formula. We've done our own research on that, looking at the size of surplus, what we call surplus profits. I don't want to go into the details, but above what might be considered normal or acceptable profits. And when we did the research a couple of 2 or 3 years ago for that, we found that before 2000, something like 4% of total profits could be described as surplus profits above normal, whereas in the 15 years after 2000, we found that something like 23% of total profits were surplus profits, and that figure is much larger for large corporations than it is for smaller corporations. So again, this question of size and the importance of market concentration being an increasingly prominent feature of corporate behavior over the course of the last couple of decades, and you can measure that importance of size, whether you look at market capitalization or revenues or assets, then concentration has been a rising feature of the corporate landscape over that period and across many sectors of the economy. And that I think that combination of domination, size is what underpins this world of kind of increased profits without increased investment, and a focus on rent extraction as being the kind of dominant corporate strategy for these particularly large firms. And we've seen, and there's lots of ways in which those firms have increased that extractive potential. I guess one that speaks particularly to industries like the baby formula industry, of course, is the role of intellectual property rights in allowing firms to dominate markets and to extract excessive rents from their dominant market positions. Of course, in the work we do, we have tried to show that this is a ubiquitous feature, but it's particularly apparent that developing countries suffer more from these kinds of asymmetries in the corporate landscape, and that's true when you look at royalty payments or illicit flows or tax evasion. Some of the issues that Ben raised in the particular circumstances of the baby formula industry are amplified when you're looking through a north-south lens, and we've, in the work that we've tried to do, tried to point to that growing asymmetry. It extends, of course, or it's extended through the trading system. The rules of the international trading system tend to exaggerate these asymmetries, and we've looked at that in the context of in particular the spread of value chains and the way in which those asymmetries are amplified through the dominant structures of international trade in the contemporary economy. And many of the policy conclusions that we've reached from that kind of work echo what Ben said: the need for antitrust legislation, the need for progressive tax rules, some of which where we have seen some progress, limited progress over the course of the last few years, but where many of the efforts cannot be achieved at the national level, particularly for developing countries, and where the multilateral system really needs to step in to ensure that these kinds of asymmetries can be addressed in a more equal manner. And so our policy agenda, I think, would very much mirror the one that Ben set out for the particularities of the baby formula industry. So let me leave it there, Emma.
Thank you very much, Richard. I think it's always really interesting to see both kind of how these trends fit into how the findings that Ben and colleagues have found fit into the broader industry, and really point to problems that we have in many, many different industries. So with that, I'm now going to pass swiftly over to Jocelyn. Thank you.
Thank you very much, Emma. And thanks to everyone for the comments so far. I want to focus really on women, because when we talk about breastfeeding and infant and babies and young children, at the heart of it, it's about nutrition. It's about the rights of women to be recognized as producers. I mean, basically, we talk about breastfeeding. This is an important part, should be an important part of how we look at the care economy, of which breastfeeding is a very fundamental part of a child's first being in this planet. And we talk about food policy and food systems and nutrition. At the center of it is those first few years of really child raising and what we feed children. So that is why, Emma, you referred to the 3 papers are coming out in the Lancet series in a few months' time. And what we've done there is really to look at the breastfeeding as an ecosystem, as a human right issue, and how the role of women and the gendered biases in the way we look at the care economy, which is invisible still, we are familiar with that. We talk about how, all the reports talk about how, for example, in this industry, the contribution to GDP, which is one of the arguments for why you do not want to disturb, right, anything in the industry by implementing the code on marketing or regulating the infant formula industry. But we find that if you really were to calculate the production of breast milk, that is a huge amount in the GDP. So this really challenges how we're going to look at statistical systems and what are the gender biases that are so embedded in the care economy, of which breastfeeding has to be recognized as an important issue. Then when we talk about how the financialization and the concentration of power and corporate power and all that in the economy that Richard talked about, and which this report actually amplifies for this particular industry for commercial milk formula, we find that really the women are in that hierarchy of exploitation, really bearing the most disproportionate burdens. So what we want to actually flag, and we do flag it in the series of papers, is that we need to really look at the role of government in terms of what is needed is really more than just saving the code of conduct for marketing of infant formula, because it's really gone beyond that, because the industry now is so full of power in terms of where it is actually deciding norms. In our study for that Lancet paper, we found that between 2005 and 2019, in the Codex Alimentarius Committee, looking at nutrition and foods for special dietary users, 70% of those who were there, the non-state observers, were from the industry, right? 70%. 28% were government delegations, and the little bit left were those who were there for women's rights and rights of infants and young children. So we see the conflict of interest, and in the heart of norm making is industry, right? From national to the United Nations. So very quickly, I want to sort of, in addition to some of the recommendations for action, in the women's movement, in the feminist discussion on this, we are looking at how we need to frame this as a human rights violation, and how do we use human rights instruments. For example, the Convention on Elimination of All Forms of Discrimination Against Women, the CEDAW Convention, has right to health in there, right? And really, it's how do we use the instrument, how do we use the Convention on the Rights of the Child so that we can trigger state obligation to protect. Because really, this is the battle for us anyway, from civil society and especially women's groups, is how do we win back the role of the state, not to be put in the corner to just facilitate profitability, but to come back to defend, and it is a matter of human rights. And so we need to really look at political economy of this industry, and also the issue of women's rights and the rights of children. So I'll just end there, just wanted to raise these issues. Thank you.
Thank you, Jocelyn. So many things in there that I'm hoping we'll be able to pick up on the Q&A. But for now, I'll pass over to Henrik.
Thanks, Emma. Thanks to the organizers, and thanks to Ben and the other authors of the report for your hard work, novel and detailed analysis that really brings something to this important task of unpicking the industry. Hello also to all of you who are participating. We are indeed a global crowd here engaged in this issue. I can see from the chat So Ben would mention some of the numbers in the beginning. There are more than 800,000 children across low and middle income countries that could have survived every year had they been breastfed. And it also helps improve maternal health. So improving breastfeeding rates in all countries is a public health imperative. Over the past couple of years, we've seen multiple crises. There's a triple burden of COVID-19, climate change, and conflict that threaten the food security situation across many countries. And we all know that children are the most vulnerable in this type of situations. And millions more children are projected to experience acute malnutrition with both loss of life and stunted development as the consequences. And we're also witnessing the largest, they call it the largest drop in childhood vaccination in 3 decades because COVID-19 has disrupted routine health services. And protecting and promoting breastfeeding, that's a proven cost-effective intervention for improving nutrition and health outcomes, both for children and for mothers. And due to the benefits of breast milk, it's really one of the most powerful and easiest to access immunization tools for infants and young children. And this is not controversial. The science is telling us that breast milk is superior, the superior nutrition for children. The evidence is indisputable. We'll have updated evidence early next year, as been mentioned by several people here now. And that's why improving breastfeeding rate is a public health goal. And that's why more than 40 years ago, the world leaders stood in the World Health Assembly, making this code that Ben mentioned in the opening to really restrict the marketing of products meant to replace breastfeeding. And even the companies in this period of 4 decades, even the companies have said they will comply, but they don't. We've seen 2 studies released by the WHO earlier this year that shows that the violations of the code and continued marketing are still widespread. So this battle over breastfeeding of the nutrition for children, it rages on. For some, for the companies and their wealthy shareholders, billions of dollars are at stake. But for others, the health and lives of their children hang in the balance. And it's not an even battle. The top companies, they use their multi-billion marketing and lobbying budgets to fuel sophisticated strategies to undermine breastfeeding. And among the mothers that we at Save the Children has talked with, they often receive a text message during pregnancy. They might have seen a commercial on TV. They heard about the superiority of substitute products through their primary health contacts. They are told lies, for example, that their children will get a higher IQ if they cut the breastfeeding and use this substitute products instead. And one of the mothers we've interviewed, she even told us that the doctor shouted at her when she said she wanted to switch to breastfeeding. So there's obviously something wrong here. And all of these practices, they are covered by the code. They should not happen. There's also the financial stress, which is mentioned in the report that will be launched here today, the increasing per capita spending on these products. So despite more than 40 years of high-level politics to protect consumers from this harmful marketing, the industry is thriving as never before, and they're extracting wealth from developing countries to high-income countries. And on the other side, you have underfunded public health budgets, lax government regulation, that really pales in comparison to the power and the influence of the government. And this is a political failure. There's a desperate need to have brave political leadership in this area. So I have 5 recommendations that I want to say here today. First, the countries where there are low breastfeeding rates, they really need to prioritize investment in maternal and child health, nutrition and services, as well as a fair employment regulation that accommodate nursing mothers to support and promote and protect breastfeeding. Second, the political leaders in these countries with low breastfeeding rates, and where they have little control over the industry, they must be brave. They must ensure systematic implementation of the code and invest in regulatory capacity. But third, as was mentioned here by the previous speakers, they can't do this alone. International organizations such as the World Health Organization needs to double down on the efforts of technical support, peer-to-peer learning, facilitating implementation of the code in national legislation. And then the governments who have power, who have real power in the World Trade Organizations and other relevant fora, they need to support the governments who are in pursuit of implementing the code nationally. And finally, us as civil society, investors, and politicians should really continue to push the companies to align their policies and practice with the code and end the marketing of commercial milk formula. Thank you.
Thank you very much, Henrik. So now for our final panelist, Anshu, before we move to the Q&A.
Thanks very much, Emma. And I just wanted to pick up on this point about the 800,000 children's lives that would be prevented if we achieve, let's say, near universal levels of exclusive breastfeeding for infants and young children. And there's an economic cost as well. We know that these preventable deaths, including combined cognitive losses and other health systems costs, would lead to over, let's say, 300 billion in economic losses annually. So that's, I think, a good counter argument also to present to countries. We know that now, 40 years after we've had the code, and we've had also many WHO, World Health Assembly resolutions to sort of support the implementation of the code, and including looking at how to end inappropriate promotion of foods for infants and young children, that we are still only at 52% of exclusive breastfeeding, of early initiation of breastfeeding, and at 42% globally of exclusive breastfeeding coverage. And so there's still, you know, a lot to be done there. And we know that clearly from what we've seen now, the evidence is there that marketing practices of manufacturers of formula is far from being aligned to the recommendations from the code and the assembly. So I think this is the reason why we sort of commissioned this report, to really provide additional evidence in order for WHO to be able to support countries in strengthening regulation to increase exclusive breastfeeding and early initiation breastfeeding initiation coverage rates. So just on the report, I think we wanted to highlight a couple of points. First, on regional patterns. We see in the presentation and in the report that there's been a large increase in sales per capita expenditure and per capita expenditure, particularly in the Asia-Pacific region and in the upper middle income countries. And it's about 75% there. And this sort of reflects potentially the change in lifestyle as these countries are having more middle class, a higher increase in middle class population, as well as due to urbanization, resulting in, let's say, different work patterns and marketing practices as well. The other point to make is that we've seen that large scales are everywhere. It's not only in the Asia-Pacific region, most likely due to the big population there. We see sort of in the slide that, you know, there's a huge proportion of the sales are in the Asia-Pacific region, but they are everywhere. And we also know that more children are receiving formula milk products than before, and the people have moved away from, let's say, using cow milk or goat milk to support the growth of their infants, and have moved towards formula products. And the other point is also, and I think people have highlighted that, but that the vast majority of the products, more than 90%, are going to stakeholders in high-income countries. And so the taxation will be in these high-income countries. And so the taxes actually do not benefit the countries where the sales are taking place. And so they can't use these taxes to either combat this or support public health in general in those countries. Maybe two other comments to make. One is around the large increases in sales of formula products are definitely a reflection of aggressive marketing practices. And I think Hendrik just referred to this as well, but this was clearly demonstrated in the report that we launched earlier this year, that around 97% of pregnant women and mothers in urban China and 92% in urban Vietnam recall formula milk marketing in the previous 12 months. And it's much lower in Nigeria and South Africa. It's around 20% there, but still there is aggressive marketing globally going on. And so this really brings to a question, let's say, where are we on enforcement of the code? And how is this being circumvented? And I think this report really contributes feedback to that. The second point is around regulation of marketing is very important. Understanding the economics and the power of the industry, I think, is an essential part of this discussion. But we should also be investing in other kinds of policies, such as maternity protection and enabling mothers to breastfeed. So the report discusses mechanisms for repatriating more of the industry profits to countries where they're generated, but it doesn't maybe comment on how maternity protection, which is critical, can be supported. Finally, maybe just to say that funding is needed to support mothers and to make the right kind of decisions and to improve their health, both their own health as well as that of their children. Thank you.
Thank you very much, Anshu, and to all of our speakers and panelists for their interventions. So we're now going to move into the Q&A component of today's discussion. Please do continue to put your questions into the chat box and into the specific Q&A function. But I'd like to start with a question from one of our audience member, Sita Shankawaneva, which I think it's really important that we come back to the fact that this is about women, it's about their children, and it's about families. And so Sita asks us, if we really do want to respect the rights of women, don't we need to put greater emphasis on considering the fact that some women just do not want to breastfeed? And yes, there is very strong commercial pressures encouraging encouraging the use of commercial milk alternatives, but that the choice and the agency of the individual should not be undermined. So the question here is, how do we balance those tensions if we're really thinking about individuals' agencies and a women's rights approach? Would any of our panelists, Henrik, I see you waving at me, over to you.
Yeah, this is a problem that's really familiar to us at Save the Children. We've worked on this issue for a decade now with campaigns in our countries. Our main avenue has been to work with investors to influence the companies. In this endeavor, we have tried always to get the public with us, succeeded at that, but also faced comments like this, and it's critical to always emphasize, as Ben did in the beginning of his presentation, that there are good reasons, there are a number of reasons why some women breastfeed. And in many countries, this is not even a huge problem. It's not a grave public health concern. But as I mentioned in my previous statement, there are many women who are cheated. They are tricked by the companies or by their primary health context that they fully trust to give them the best proper advice, and they are bought by the industry to give ill advice in maybe one of their most vulnerable situations in life. That's something that we really need to combat, and it's a human rights issue, as Ling mentioned earlier. It's been established in the UN by those who decide human rights, the world leaders, that unbiased information about nutrition for the children is a human right, both for the parents and for their children. So it's a really important message, and we just have to be careful to keep in mind that for some women, of course, these products are necessary.
Emma, if I can jump in quickly on this, yeah.
Please do.
No, I think that's why really, the kind of research and the kind of calls for the right policies now is really going to more systemic targets, right? Because yes, ultimately it is a choice, but we're talking about not having that choice if you don't have proper maternity leave, paid leave, you don't have your work environment, if you are in the formal workforce. You are in the informal workforce, you're part of the global supply chain, but you are in the informal sector. There is just nothing unless you have a public health system that actually facilitates and supports breastfeeding and young children care. So that is why in the end, there is a real need for public policy and for the appropriate funding. Then we can talk about where the real choice can be made. But right now, those choices are taken out of your hands. And the trends we see of increase in switching to commercial formula milk substitutes is also among the poorer parts of society, because these women, in that sense, have no choice. Because they have to work, they have to be, and they're under stress. And we know that if you're under a lot of physical and emotional stress, you're not going to be, if you're not healthy, you cannot be producing milk for your baby. So that's just really the whole collective that we really need to look at. And I think WHO's work in all these years, and we're really, really happy that, because 40 years later, even the marketing, it's just rampant, and all the evidence shows that it's just gone even worse. Why is that? And so we do need to pull it back to using all the different tools that we have raised tonight, and we need to really take that into advocacy, and that's what we hope all these papers and reports will contribute to. Thanks.
And maybe, Emma, just to add to that, I think what we are concerned about is the harmful marketing. So it's not about removing choice, but it's really about the harmful marketing. We know that the industry targets healthcare workers to convince mothers to use breast milk substitutes. And we also know that the industry reinvests 5 to 10%, so around $3 to $5 billion into marketing around this. So it's really around the harmful marketing that, we have our concerns.
Thank you, all three of you, for clarifying those. I would like to pick up on a comment that Jocelyn made actually around the role of the informal economy. So, globally, there is a heavy skew. Around 55% of the informal economy is made up of women. When we look at low-income countries, that's even higher. Something like 92% of women are working within the informal economy. And Richard, you spoke about kind of these big trends around deregulation, increasing job insecurity. And so I wonder if you could talk a little bit about what you think the gendered dimensions of those trends might be, and their impacts of the ability to choose, really have a true choice. You're still muted, Richard. One moment.
Yeah, I mean, informality has, it's traditionally been associated with developing countries. Within that space, I think the challenges that face women and minorities are always greater within that informal space, and that has now gravitated to the advanced economies. The rise of informality in the advanced economies has been a more recent trend, but you see the same inequalities within that informal space, in which women and minority workers are the ones that are most vulnerable and most mistreated. And so I think as I understand it from the discussion of the US case with baby food formula, that was apparent in the recent challenges that I talked about at the beginning of my comments. And and behind it, behind it is the deregulation of labor markets. Behind it is the general attack on collective bargaining rights. And despite all the challenge, we know that there are lots of challenges with traditional trade union movements with respect to not, at least in their heyday, of not effectively addressing the particular challenge of women workers. But in the absence of those kinds of institutional mechanisms for collective representation, these degrees of discrimination are almost certainly likely to continue and if not worsen. And more than that, I think, at least the point that we have been trying to make is that without the kind of countervailing power that trade unions have brought to the workplace, then this indiscriminate power of increasingly large and footloose corporations magnifies even further. And so, I think there's some particular issues that have to do with the gender dimension, but there are also these incredibly important issues around power asymmetries more generally that are distorting markets and producing hugely unequal outcomes across the board.
Thank you very much. And so picking up on that theme of power asymmetries, I'd like to put a question to the panel from Maria Heron. And Maria says, given the conflicts of interest at government level in countries, and we often think about our state actors as perhaps helping to deal with some of those power asymmetries when it comes to corporate actors, where you may have on the one hand, say if you take the British, the UK and Ireland, the Department of Health or the NHS are recommending breastfeeding, but on the other hand are actively promoting commercial milk formula industries, perhaps through the Department of Agriculture or Departments of Industry. How do we balance these conflicts of interest at a state level? And what role or what options do we have around legally challenging these conflicts? I ask if any of the panelists would like to pick up on that. Henrik, please.
Yeah, I'm not sure how to legally challenge this, but the code have clear recommendations on the marketing side of things, and you can promote an industry without condoning practices that you have already agreed that should not occur in an international forum. It's just a matter. Sounds so simple. It's just a matter of implementing this code in the national legislation. Now, the EU has a directive, which Britain also was at the time was a part of the EU when this was implemented. That goes a long way to include most elements of the code. In Norway, we don't see any commercials, any marketing of breast milk substitutes. That's because we are part of this directive from the EU. So this is already regulated. It needs to be strengthened. You need to talk to the departments of government that follow up on these directives in your country to see that what is already there is actually monitored and implemented. This is what I mentioned before, to invest in regulatory capacity. And where there are shortcomings, then it's a longer conversation. We have to look to the code always. It's updated biannually. It's a good moment, a good chance to raise this at the top political level. This is what we're doing also in Save the Children now.
Thank you. Anshu, I see. What are your thoughts on the role of the code?
First, I want to just come back to this issue of the informal economy. We know that around 800 million worldwide are working in the informal economy, and about 88% of women working in India and in Africa are sort of, in the informal economy. So it's really a critical issue on how to try to address this. And so there's some research now looking at conditional cash transfers and how that could potentially support women working in the informal economy. So on the role of the code, I mean, the role of the code clearly needs to go beyond health. It's not only because there are so many social issues that need to be addressed, such as, maternity protection, etc., but also the issue around trade, and that has been highlighted, I think. So it requires high political level awareness. And so that's one of the things that, as within WHO, we're thinking through now, is maybe how to reach out to those higher level political influencers to try to see how we can get the agenda on, to go beyond health and to get it on a broader platform.
Please.
Yeah, Emma, I think from our analysis, and I think this is not just our analysis, but the reality is that we're talking about deep systemic inequalities because the economic policies, whether it's finance, all the debt burden of countries and from household, as Richard said, to sovereign debt. So we're talking about, the range of very deep structural barriers, not just to breastfeeding and nutritious food, it's across everything. We think about health, we think about food systems, education, you name it. So this has to be part of the bigger tackling of those the fundamental drivers of those inequalities. It's a systemic issue. Now, not to be overwhelmed, it means that we have movements, we have enlightened governments, we have advocacy at the national level. So how do we make the linkages? Because in the end, we're talking about accountability, we're talking about human rights and the role of the state, we're talking about how to use competition law and antitrust law to really push back. So we have legal instruments, so we have a whole range of potential instruments, and we also have ideas about kind of policies we want. So how do we, so it's the power, who holds the power, who decides? So even if a government, you may have a new government that comes into power and really 80% of the cabinet supports what we want to do across the board, right? But they will find it really difficult. So I think that's that's a challenge for us all. And that's why I think what is for me very exciting and important is that each of these pieces of research that we're doing through the WHO and Lancet and this report and beyond this is we have to link the work we do in academia and research to policy, and to get that policy to become real, how do we do advocacy? It's not going to be easy, but we need to do that and to really make use of all the potential instruments that we have at hand.
And Richard, I'll come to you and then I'll go to the next question.
Yeah, you have to excuse my ignorance because I don't know the nature of this code of conduct with respect to these questions. But, obviously UNCTAD was a strong supporter of code of conducts and tried to devise some itself in many respects under a more hospitable environment where states had considerably more power than they do today. I mean, the experience with codes of conduct, because they are soft law, they tend to operate along soft law principles, are either they're incredibly easy to circumvent, or even if they have some legalistic punch behind them, I mean, in some of the industries I know, firms don't really care because the kinds of profits that they can make under current circumstances means that the fines that they may face if they breach these codes are minuscule relative to the kind of money that they make. And therefore, I mean, that's obviously true in the case of finance, but it's become actually a very common pattern across a lot of industries over the course of the last couple of decades. So I think back to Henrik, without that kind of without rethinking the regulatory environment, it's tough for me. I don't know, partly in my own ignorance, I'm sorry for that. It's tough to me to see how it can really rein in some of the kind of malpractices that seem to characterize this industry as we've found in other sectors of the economy.
Thank you, Richard. Henrik, please do respond.
Yeah, it's just a short comment that there are some positive examples that we've seen during the last decade and more of successful implementation of code in national legislation, which has very effectively removed marketing practices. The direct implications of child health is more difficult, of course, to measure as such, but yeah, it's definitely possible. It's just a matter of political will and the necessary investments.
So actually, I'd like to pick up on that comment about political will, Henrik. So we have a question from Magdalena, and this is kind of moving from the high level politics down to what happens for health workers who are working in the field. And she says, when industry and their lobby groups target high-level politicians and their wives, so really kind of influencing how much will individuals might have. And she talks, for example, about Timor-Leste last year, using president and the prime minister's wives during an emergency to push formula powders. How do people on the ground, how do health workers strategically deal with these situations to give advice to the women and families that they're working with when these high-powered lobby groups are working against them? Any advice, please?
Yeah, so this is also a very relevant example for Save the Children with the conflict in Ukraine just now, with the response to volatile situations where people are on the move, they are not in the vicinity of their regular health caretakers, for example, or it's not available at all. It's really important that organizations that respond on the ground have very strict, well thought through and prepared policies of their own. So this is what we've done for Save the Children's response, for example, in Ukraine now, that there's been documents prepared. How do we tackle, for example, blanket donations that come in from large producers of breast milk formula? How do you balance this in a war situation or in a refugee camp situation? And it's really important that the community health workers or the humanitarian health workers that respond in such situations have the proper training to give the right advice, and that is to continue breastfeeding as far as that's possible, also in these volatile situations. So yeah, proper planning, strict internal documents for the responding organizations. That would be my best advice.
Anshu, do you also have a response?
Yeah, I was just coming back to this point, I think, about healthcare workers really being targeted themselves, first of all, by industry. And in a number of countries, when the president or the first lady would be promoting, it might be difficult. But I think this comes really back to the point of regulation. We really need to support countries in regulating the influence of industry. So including targeting healthcare workers, but also, and this is the role, I think, of civil society, to advocate with politicians and parliamentarians, and including heads of state and first ladies. So I think it comes back to the issue of how to implement the code and how do you regulate that at country level.
Thank you. Now, that addresses kind of what happens in these emergency situations. But I mentioned at the top of the webinar that I delivered my second daughter just at the beginning of this year, when we were still dealing with COVID issues. And one of the big concerns I had about how my potential inability to breastfeed my daughter was the fact that if either of us were detected or tested positive for COVID, that the Ministry of Health policy at the time would be to separate myself and my child, which obviously goes against many of the recommendations around how we initiate breastfeeding, with the WHO recommendation being to initiate breastfeeding within the first 60 minutes of life. So I wonder, Andrew, maybe can you talk about how we balance these contradictions between perhaps the pandemic policies? COVID hopefully is on its way behind us, but the reality of another pandemic is that it's something we will have to deal with. And this push, as we say, it's a public health drive to have as many people, as many women and individuals who can breastfeed as possible.
From day one during the COVID pandemic, we've been very clear on that at WHO, that there was no need to have separation between the mother and the baby. We sort of advised for a number of measures that mothers could put in place during breastfeeding, but there has been no evidence that there has been transmission through breast milk and breastfeeding. So I think we've been very clear on that from day one, that there was no need to separate the mother from the baby for breastfeeding.
And so on that, we have a question from Noor Kamira, Mohammed Awi, who acknowledges that this really was policy in many places. And she wonders if there is any evidence to suggest that big milk, that formula marketing may have been influencing the decisions that healthcare providers were making, and how much that might extrapolate to what we see in hospitals and primary care provision more generally. Does anybody have any thoughts on that? I mean, without us, of course, we don't want to be speculative here, so it's only if we think we have data to suggest. Anshu?
No, I don't think we have any evidence so at the moment, but I know that this issue always comes up also, for example, with Ebola and other infectious diseases, and I think there's never been really clear evidence that there is transmission through breast milk and breastfeeding. But I mean, it might have been that industry has sort of, used that as an opportunity to suggest that there is transmission during breastfeeding. And so that's definitely something that would have to be addressed here.
Thank you. Okay, so I'm going to slightly switch topic now. We have a question from Chanara Nair Jayasignan, and she asks for the panel, what are your thoughts on sugar tax? And what role do you think that might play in deterring or reining in the milk formula industry? Any takers? Anshu?
Yeah, I think, we're all in favor of sugar taxes, but I don't think that would as such rein in the breast milk substitute formula industry. So we do think that we need to address what we call the commercial determinants of health and harmful commercial marketing practices, whether that would have, whether that would set a precedent and whether countries therefore would be more amenable to implement the code, etc. It's difficult to comment on that. But nevertheless, we do support the fact that, we should have sugar taxes.
Right. Now we have a question from Julie, who says that in Australia, antitrust laws are used to argue against implementing the code rather than facilitating control of breast milk substitute companies. And so she asks, how exactly can antitrust law protect breastfeeding against marketing? And I see that Yokling had one question to Julie about what some of those arguments might be, but I wonder if that's a situation that any of our panelists have familiarity with.
Thanks, Rhea. I'll jump in. I think that's a really good question. And so, I'm not, as a disclosure, I'm not an expert in antitrust law, but I guess I'm becoming more familiar with antitrust law. And I guess it depends on which antitrust law we're talking about here. So antitrust law that's underpinned by consumer welfareism, which it currently is in most jurisdictions around the world, wherein the objective of antitrust is to promote output maximization of whatever product or service we're talking about, and to lower really consumer prices is clearly incoherent with a number of markets of public health concern. So I think infant formula being one of them, but we could also link that to tobacco, alcohol, gambling, and so on. But there are signs that antitrust law is also, there's a social and political momentum behind kind of reinvigorating antitrust law to be much more about dispersing power. And so whether or not we can make links between using antitrust as a tool to deter marketing of a specific product, I'm not sure. But I think more broadly, there are discussions, particularly in the US and more so in the European Union, on using antitrust law more fundamentally as a trans-sectoral, economic tool to disperse power. And so if you disperse power, then indirectly it's going to have an effect on the ability for corporations to market without actually getting into specific kind of marketing kind of regulation considerations. But I guess on that as well, I mean, that's going to require obviously international coordination of antitrust, whether antitrust in a specific jurisdiction can take down a global corporation. And so that's when we can then think about, well, there are jurisdictions actually that do integrate broad public interest considerations into antitrust, with I think South Africa being the pertinent example. Once again, I mean, there's no explicit consideration of marketing of specific products, but more broadly, it's about one of the public interest considerations that the antitrust agencies and courts are mandated to consider are really economic development and prosperity issues for disadvantaged population groups in South Africa. Really is a legacy of apartheid. So once again, there's no real direct links there between kind of using antitrust to directly block marketing, but it's easy to see how antitrust, underpinned by the very harmful consumer welfare paradigm, can be used to, I guess, against these forms of so-called kind of coordination between competitors. And I mean, I won't go into European Union because I know they have competition law talks about and regulates state aid, which I don't think is that relevant to the Australian context. But just, I guess, in summary, it depends on which antitrust law we're talking about here.
Maybe I can just quickly add a comment. What is really interesting is that we are seeing a growing use of antitrust law in the pharmaceutical sector, because really at the heart of it is that, and as we see from this report, the dominance of the market is so high. And so when you have a dominant position in the market, antitrust law then kicks in to see what your conduct is like, right? And the consequences. So there is a body of jurisprudence that is growing now in the use of competition law to push back on the abuse of intellectual property monopolies. And it is actually happening in quite a number of countries. And the competition authorities are actually coming together to really share experiences on cases. So I think that, to answer Julie's question, perhaps really is about how the abuse of the dominant position in the market by this industry actually then leads them, for example, to, I don't know, I think this will be areas that have to be tested in the different, as has been said just now, in different countries and what the competition law actually entails. It will be, the way they outright, because they're very blatant in the harmful marketing, right? And there's also a code. And then at the same time, they are also actively lobbying against regulations. So I think it's really worthwhile exploring this as one of the tools. Thank you,
Richard.
And I think in that context, Yokli, I mean, you know more than me. In the pharmaceutical context, particularly in the oxymoron, in the these new high painkiller drugs, it was that legislation in the US has targeted the behavior of healthcare professionals and the way in which they were captured or used by some of these companies to promote in a dishonest and deceptive way the spread of oxymoron and these other very addictive painkillers.
So as we come towards the end, I'd just like to pose one last question to the panel. Yokling, in your intervention earlier, you mentioned that at one of the big meetings, 70% of the people or the participants in the room were from commercial entities. And Patty Rundle asks us whether this could help indicate a new approach that recognises the risks of multi-stakeholderism, and that perhaps bringing so many new people into the room has actually caused more problems than it has solved. In part, perhaps due to inadequate conflict of interest rules. I wonder, it's quite a big topic to end on, but I wonder if we could touch on it because it is a vitally important one.
Yeah, I think we could have a whole separate discussion on the trends of multi-stakeholderism and how risky that is. But absolutely, I think the example I gave was the Codex. Now, of course, in many of the multilateral processes, we have an observer, sort of a track, So what we see there is we are not against having interest groups. We as civil society also push for observer status to be able to be involved and to contribute to norm making, etc. It is very important for the UN agencies or for governments at the national level to have very clear policies that because of the power asymmetries and the vested interests of different players, then we're not stakeholders, we are not equal, and we're not sitting around the table as if we are all friends. We have deep conflict of interest. Among ourselves, we have conflicting interests, and many of these industry representatives and their associations, most of the time they don't go in as companies, they go in as their associations. So then the UN has to be very clear about the roles or how do you define a non-state actor? Everybody from the Gates Foundation to company associations to civil society groups are non-state actors, and that is a problem. All right, so that really needs to be unpacked. For Codex, for a long, long time, the only, the participation was very much northern governments. The South was not very active in those norm setting in the Codex, and industry was in there in full force. It's only in the last many years that some non-governmental organizations have gone in, but still not enough. That's why we see the imbalance if you look at the data. But to get involved in these processes means you have to really get into the technical things. And I think some people who are in this, listening in on this webinar are themselves working on Codex, for example. So we do need to actually arm ourselves so that when we talk about civil society advocacy, it is as much about technical, legal, details as it is about calling for policies. And I think that's a combination of, and this is where the real partnership with academia, with research as rooted in reality that informs policy making is so important for us to be able to use that in our engagements.
And I think that is a fantastic note to end on. I would just like to take this opportunity to say thank you so much to all of our panelists for the presentations that you've given us today and for the thoughtful responses to the comments, to the many people who've joined us, who have been posting questions in the chat and through the Q&A function. I'm sorry only that we were not able to address all of them, but I hope you feel that we have had a wide-ranging conversation today that's addressed both the structural issues, but also thought about, really what is about families and about people and has women and children at the heart of this conversation. Do know that if you either missed the beginning part of the conversation or you'd love to come back and watch it again, the recording is available on the UNU IIGH YouTube page that you can contact and find all of our speakers today, either through their organisation or individual Twitter and social media handles. We do encourage you to download the report, read it, share it, and I hope that it continues to generate, we all hope it continues to generate more ideas and questions as we move forward in this area of work. So with that, thank you very much, and I wish you all a lovely weekend.